Our last presentation of this public special session will be on the state's insurance market response to COVID-19 crisis. Please welcome by audio only Commissioner Jessica Altman of Pennsylvania and Chair of the NAIC's Health Insurance and Managed Care Committee, most frequently referred to as our B Committee. Jessica is the A team on our B Committee. So Jessica, we appreciate you being here today.
Thank you so much, Director Farmer, and apologies to everyone to not be able to join by video today. I've had some technical glitches, but happy to be here by audio only. As of earlier this week, nearly all states have announced actions to respond to the coronavirus outbreak. Insurance regulators have worked with governors, emergency managers, industry stakeholders, federal partners, and others to help respond to the crisis, protect consumers, and ensure continued operations of essential services. To date, state insurance regulator actions have focused on a number of areas, limiting consumer cost sharing for testing and associated office visits. Some states have also sought to address cost sharing for treatment as well. Facilitating access to prescription drug refills, encouraging access to telehealth services, verifying provider networks, notifying consumers of their coverage and cost sharing waivers, preventing inappropriate utilization review, and ensuring continued operations of key services. I would note many departments are also taking actions in areas other than health insurance, but we're going to really focus on those health insurance related steps today. Some states have used emergency regulations or enhanced authority under governor's declarations of emergency to mandate insurer compliance with their directives. Others have requested insurers to take appropriate actions, and some have announced voluntary agreements on the part of insurers to take responsive actions. To help spread awareness, some of the less common actions that states have taken include asking or requiring insurers to report to the DOI on steps they are taking in response to COVID-19, asking insurers to extend claims filing deadlines, calling on providers to refrain from balanced billing, directing state regulatory boards to take action against price gouging by any healthcare professional or healthcare institution in relation to COVID-19, publishing consumer-focused FAQs, requiring accepted benefit plans to notify their enrollees of coverage limits, making the same requests of short-term limited duration plans as comprehensive health insurers, and requiring zero cost sharing for a coronavirus vaccine if and when it becomes available. Additionally, 8 state-based exchanges have created special enrollment periods to allow new enrollment. The NAIC has been tracking state actions and can share more details with interested regulators. I think it's most important today that we hear directly from some of the states taking these actions. So we've teed up a couple of states to start the discussion by talking about what the steps they have taken thus far, North Dakota and Washington, that have taken innovative approaches. So with that, Commissioner Godfrey, we'll start with you and your decision to apply the coverage requirements to short-term limited duration plans and travel insurance as well. Commissioner.
I guess a real whole long explanation of this. We took the approach of this is an all of the above response, and we're all in this together. Is kind of what our mantra is here in North Dakota, is that we're working together to solve this. So we took a very collaborative approach with our health insurers, and given some of the regulations we expanded last legislative session for us with the short-term limited duration plans, we felt it was certainly appropriate to roll them into the cost sharing of the COVID-19 testing. On the travel insurance side, we just wanted to make sure that there wasn't, unless it's explicitly exempted, that the COVID-19 treatment or transportation would be covered. We think that's a fair situation at this point. Given the nature that some people who were traveling that needed to get back for healthcare need to get back to where they needed to be, and generally that's why you buy travel insurance. And so we wanted to make sure we were closing as many loopholes as we possibly could in order to, again, provide that all the above response for our consumers who, frankly, are in an unknown, unprecedented situation as well, and so provide them the comfort that the insurance they did purchase will be there as much as they can within reason to help them through this situation. So for us, it was a very collaborative approach. We were very transparent and open with our carriers on this issue, and to our carriers' credit, they stepped up to the plate and were willing to do this in a collaborative nature, which obviously didn't require us to go to an executive order or anything like that, but it's been a collaborative nature here in North Dakota. But the reason we included everybody we did is because we think this affects everybody, and it should be kind of an across the board response.
Thank you so much, Commissioner Gottfried. And now I'm going to turn it over to Commissioner Kreidler, who's going to talk about the decision made by the Washington Health Insurance Exchange to create a special enrollment period. Commissioner Kreidler.
Commissioner Altman, it's Mike Considine. Unfortunately, I think Commissioner Kreidler had some technical issues as well, so he is unable to participate right now.
Not a problem, Mike. Do we have, there have been a couple of other states who have opened up special enrollment periods, and if any other commissioner would like to talk about that decision, I will note my governor, as well as I believe at least New Jersey's, have sent letters requesting the federal government to do that for those reliant on the SFM. But do we have another state who'd like to speak to that?
Commissioner Altman, I would like to hear from the state of Maine what Superintendent Chapa might have done on his exchange.
I would love to hear from Superintendent Chapa. Thank you, Director.
Can you hear me, Director?
Yes.
What we did in our exchange, I have an emergency reg. Once the governor declared a health insurance emergency, it allowed me to give me broad authority and taking action similar to other states. I've taken, of course, required the payment of the COVID testing and associated fees. I've issued an order yesterday, and I'm issuing another one today on telehealth and one on credentialing. So it's really a fluid situation. The broad order, and I've been reaching out to all my carriers, and basically I'm saying whatever it takes to improve access for consumers so they can get the healthcare services we're going to do, and I'm in contact with them almost daily. That, but again, I have broad authority in issuing the order I did, and I intend to keep modifying as circumstances arise. And the perfect example of that is a telehealth issue. I'm following New Hampshire and Massachusetts lead. They are making telehealth available. And one thing we've noted in Maine with healthcare providers and the request to delay services, there are now healthcare providers and hospitals in particular. You know, I'm concerned about you know, cash flow for them. I haven't heard anything, but the next step is talking to carriers about being in constant touch with providers about cash flow. So I think that's the next item on my agenda, is to make sure you know, providers have the resources they need to provide services to consumers.
Thank you, Superintendent. Here in South Carolina, we've had the same issues. We have not issued an order. The health insurers, to their credit, have been flexible, have been helpful. Our governor issued a request on Tuesday for companies to expand their telehealth provisions, their coverage to lines other than COVID-19 or illnesses other than COVID-19. We've had a great response on that. That keeps people out of doctors' offices and emergency rooms, and it's truly a time for everybody to stay home. Commissioner Altman, do you have other comments?
Thank you for that, and thank you for that information, Superintendent. I can tell you in Pennsylvania, we are also working incredibly hard to get out guidance, to answer questions coming in from our regulated entities, and to be responsive to the needs both of consumers, but as our insurers who are operating not only to serve their policyholders, but also in many cases as large employers in the state trying to understand how to take the best actions on behalf of both their policyholders and their employees. Now I'd like to open it up in case any other commissioners for now either would like to talk about steps that they have taken or are thinking of taking in their own states, or if they have questions of other commissioners in regards to state actions that have been talked about or you've seen.
This is Mike. Can I jump in?
Sure.
So we've taken a few actions similar to what other states have done. We have a special enrollment period that opened today. We also issued an emergency regulation last week that will require the insurance companies to cover telehealth for COVID-19 related issues without cost shares, requires them to cover COVID-19 testing without cost shares, and then it allowed for one early prescription refill. And we're working on other telehealth issues too. But one thing that the team is working on actually as we speak right now that I would imagine is probably going to start to hit a lot of our different markets, and some of the folks on the panel might have thoughts on, is we're working with both our insurance companies and our hospital association to figure out how we're going to handle or help the insurance companies handle billing as patients that are not COVID-19 patients get transferred from facility to facility in order to make more room in the facilities that can handle the COVID-19 patients. There's going to be at least some amount of transferring from things like Children's Hospital, moving kids to Children's Hospital that don't have the disease, or just patients from system to system, hospital system to hospital system, in order to make more capacity where we need capacity. There's going to be billing issues, obviously, that pop up related to that. So we're starting to step in to help along those fronts. I think you're going to see that happen in all of your states. So if you haven't yet, I would encourage you to reach out to your hospital associations and start to have that conversation. And if anybody, the folks that were on the panel earlier might have some thoughts on that too.
Thank you, Commissioner Conway. Any other commissioners want to add on? Hearing none, Mike, do we have any questions in the queue about state action?
Thank you, Commissioner Altman. No, we do not have any questions in the queue for this particular topic. I expect that will be we'll be discussing further in the regulator session this afternoon, but nothing further from this side.
Commissioner Altman, this
Perfect.
is Commissioner Lara. I don't know. I'm trying to figure out this voice. I don't know if you can hear me.
We can hear you. Go ahead, Commissioner.
Okay, sorry. I was trying to catch you before you moved on to questions. I just wanted to give an update too on California. We are requiring our health plans to give us an emergency plan by today to all the carriers in terms of how are they going to maintain access, affordability, and key services available during our emergency period. And the deadline for those are today. So we'll have a bigger picture in terms of what the insurance companies are planning to do in terms of keeping coverage available, keeping claims being paid and so forth, and how they plan to do that, and also addressing the unique needs as we figure out the essential services and the social distancing and all that. So we'll have a better picture for us in California once we start receiving the plans from the health insurance companies today.
Wonderful. Thank you, Commissioner.